I'm actually really excited about this because I have so many questions even for myself. But is there a difference between plastic and cosmetic surgery and who specializes in them?
Oh, that's such a great question. Let's start by distinguishing between minor office cosmetic procedures such as Botox, fillers, lasers, the kind of things that could be done in a med spa versus actual surgical procedures. You see Botox and fillers being done everywhere, and those are often done in med spas under the supervision of a dermatologist, or many specialists will do that. But when we start talking about real surgery, going to an operating room, having anesthesia, having incisions, and having real surgery, then we're in the realm of plastic surgery. Cosmetic surgery is part of plastic surgery. How do you know you have a real plastic surgeon? Because they're certified by the American Board of Plastic Surgery. That means that they've done a residency training program with at least 6 years of clinical training after medical school. Many, like myself, do a lot more than that. I did 10 years of training. And then they take a rigorous set of examinations administered by the American Board of Plastic Surgery to make sure that they're safe and competent to go out and operate in the community. And for all of our viewers today, if you want to know if a doctor is certified by the American Board of Plastic Surgery, go to that website, the American Board of Plastic Surgery, and you can put in their name and you'll find out. So you really want to make sure you have someone who's board certified when it comes to actual real surgical procedures.
Absolutely, because we hear the horror stories, doctor, from so many doctors that
Yes, we do. Yes,
do the wrong
do.
thing, if you will. Yes. So I started talking about cosmetic surgery, and I mentioned to the viewers that more and more people are having cosmetic procedures, especially the non-surgical ones. Look at this graphic, and doctor, let's talk about it. This is amazing. According to the Aesthetic Plastic Surgery National Data Bank, procedures for Botox increased 54% in 2020 over the number in 2019. And the number of people getting fillers injections to help fill in facial wrinkles increased 75% in the same year. Wow. Why do you think? Because you look so wonderful after you do it?
First of all, Botox and fillers are very, very popular. They have a great safety track record. And especially in the last year when everyone's sort of been watching themselves on Zoom meetings and video, some people speculate that they're seeing themselves a lot more often, and they're a little bit more inclined to investigate these treatments. But they're fast, they're easy, there's not a lot of downtime, and they can make a big difference when done well.
Absolutely. And the next day you hear people say, or the next few days, you look so refreshed. What'd you do? Oh boy. Doctor, I have a question here from Kelly, and it's a condition that her husband has. So let's take this question. I'll read it out loud and let's see what you say to it. It's great to see an organization that makes asking questions so accessible, and that's very nice of her to mention. My husband has been struggling with frontal fibrosing alopecia for several years now, and he hasn't felt it was worth getting treated yet. But it is starting to upset him, so he's looking into options. So far, he has been offered tetracyclines, steroids, injections, and oral retinoids. Can you speak about the pros and cons and risks and benefits of the treatment available for this condition? Thank you so much, Kelly, for writing in.
Yeah, Kelly, wonderful that you asked that question. Alopecia is very common. Most people get it just genetically. They get male pattern baldness. In this case, your husband has a medical disorder that's leading to the alopecia. And hopefully your husband is under the care of a dermatologist. The different agents that you described, the retinoids, the tetracycline, the steroids, could all be potentially effective. The tetracycline, if there's an infectious cause to this fibrosing alopecia, that may be very helpful. And that's a great one to try first. But again, I haven't seen your husband, so it's not easy for me to give medical advice on a specific case. The retinoids can also be effective. However, if they're used topically, then sun exposure can cause more irritation. And then steroid injections have their own risks. They can cause changes in pigmentation. They can cause thinning of the fat layer under the tissue. They can cause the formation of some spider veins in those areas. So all of these have different risks and benefits. Again, with your husband being under the care, I'm sure of a qualified practitioner, dermatologist, for example, I would speak to them about the specific risks and benefits in your case, but all of those are reasonable therapies to use in this instance.
Thank you, Doctor, very much. I have another question from Paulette. I love this question, Paulette, because I've been invited to this as well. So let's take this question from her. Before COVID, I was invited to a couple of Botox parties. Are they safe? And there's always wine and cheese involved, Doctor. Now, I haven't gone to any. Full disclosure here, I haven't gone, but your thoughts?
Paulette, thank you so much for asking that question. The idea of Botox parties, it's been around for a long time. They certainly happen, but it is something that it's really discouraged by a lot of our professional societies, because we have to remember that Botox and fillers are real medical treatments. And you want to have them performed in environments where you have emergency equipment available in case someone has a adverse reaction to it. Additionally, you don't really want to mix medical treatments with alcohol. And every patient needs to have a thorough and careful evaluation by the doctor to make sure there's a good candidate. And then you also have the issue of peer pressure. Everyone's there at the party. Everyone has expectation that they're going to get treated just because they're there. So there are a lot of pitfalls to Botox parties that can compromise safety. Absolutely, there are ways that all of those risks can be mitigated, and it can be done well. But it's something that's really discouraged because it's so hard to reproduce the environment of a medical facility.
And doctor, we all know, at least most people know, that when you get Botox or fillers, you obviously have to replenish every 3-6 months. It depends on the individual. Are there any long-term effects if you get it, besides maybe not looking like you want it to look like for a little while?
Sure. So in the absence of any adverse reactions, any complications, there aren't any real serious long-term effects from most of these agents. There are some exceptions to that, of course. So a lot of the fillers that are used right now are based on a compound called hyaluronic acid. It's a naturally occurring protein in the body, and it dissolves and it degrades. And those have a really great safety record. And yes, they do go away. But when it comes to other agents that may be more permanent, that's where we start to see some issues. So I tell my patients the only thing worse than a filler that goes away is one that doesn't go away, because then you sort of age around it and you always have that filler in place. And after a while, it's not going to be in the right place. So for most of the agents that we're talking about, for Botox or other forms of botulinum toxin, that's sort of the generic name, and most of the hyaluronic acid fillers or absorbable fillers, there aren't any really serious long-term risks in the absence of complications.
Fantastic. I'm going to move on to liposuction, but before I do that, I just want to remind our viewers that if you want to send a question in, all you have to do is send us by email right there, questions@allhealthtv.com. Give us a call, 855-796-4475, or record your question right on your cell phone, upload it to our website right there on the right-hand side, allhealthtv.com. All right, doctor, let's go to liposuction. We see lots of ads about that. Are they safe?
Before we go on to liposuction, let me just make one mention. I talked about risks and the fact that even minor procedures like Botox and fillers do have risks, and some of those risks can be very, very serious. So again, important to be in the right environment and with a qualified physician overseeing that.
Thank you for adding that. I do appreciate it, and you're absolutely right. Okay, liposuction. Obviously, find the right doctor who is licensed to do a good job. But are they safe, doctor? And is it usually just for people who are obese, or is it for those who just maybe have a little tummy and they kind of want to take care of it? By the way, I have one.
It's actually just the opposite. It's not for people who are obese. The best candidates for liposuction are people who are really close to their goal body weight and are in shape and have those annoying fat deposits that just won't go away despite all the exercise that they do. A lot of these are genetically determined. If you look at your parents or your siblings, they may have the same fat deposits in the same place. So liposuction is really a great treatment for people who have very focal or very kind of focused fat deposits in one area, and also have good skin tone around it. Because remember, when we do liposuction, we're taking fat out from under the skin through a hollow tube, and we're relying on the elastic ability of the skin to kind of shrink down and cover that area afterwards. So you don't want to do liposuction for someone who has loose skin already, or skin that's not very elastic. But it's something that hundreds of thousands of people in this country do every year, and a procedure that again has a pretty good track record of safety. It's a very common procedure in cosmetic surgery.